Hey, I can't hear anything. Chantrice, I can't hear you at all.
All right, I'm back. Can you hear me now?
Yes.
All right.
He's back. Hey, girl. Hey.
Hey, honey, how are you? All right. Okay, dokie, you back.
Let me show my face.
How are you?
I'm good. Busy, busy. You?
Girl, listen, same. Okay, same,
Crazy busy.
same. Life is
There we go.
busy, life is
Hey.
crazy. Hey, all right, how's it going?
I'm good. How is life?
Girl, busy,
I
busy.
know, right?
Listen,
Hey,
but we
busy
gotta
is
do what we gotta
good.
do.
Busy is
Yeah,
good.
the business is definitely good. Not busy is work. So I'll take busy.
That part. I don't
Most
like this
definitely.
blur screen. What is this? Off. Yeah,
Your
no,
background, I'm
I
blurry.
don't like it. Look like a weird AI.
You said I don't like it. Fix it. All right. Well, I'm gonna go
Hi,
on.
Anna and April.
Hi there.
Hello, hello.
Welcome to the port. All right. Let me. All right. All right. Well, I'm gonna go on mute until more people join. I'm about to drop something in the chat,
Okay.
and we'll get started. Oh,
Hello, everyone.
Hello.
hello. Welcome.
Let me see if I can. Not as much as.
Where's
Happy
Hi, Happy New
Happy
Year.
Thursday. Happy New
Hey,
Year.
Natalie.
Hey there, Tamika.
I
How
know
are
it
you
was.
guys?
We didn't do that part one last. That was last
That
year.
was last year.
It was last
Last month,
year.
last
Yeah.
year, all
I
of
can't even keep up with time.
I know.
Dang.
I know.
I'm
We're gonna
still
be
writing
saying Merry Christmas
2025.
again in a minute.
Yes.
Still 2025.
I know, right? And it's about to be February. Can you believe
That
that?
Listen,
part.
like what has
Wow.
happened? Where's the time going?
I know. I know. The time is going.
It is going.
Mm-hmm.
Okay.
Thanks to everybody that's joined so far. Hey, Belinda. Um, in the chat, I just put a quick, can you all in the chat, for those of you that have joined, can you just put your current location and then what is your current career? And just drop. Hey, Belinda.
Hey, I'm trying to fix my settings and all the
Got it.
things.
Hey, Belinda.
Belinda.
Everybody.
Hey,
Hi.
hey.
That's the same thing Tamika said. She's like, what is happening? I don't like this screen. Let me
That blur.
see.
She's
I
like, what is that
know.
blur? You gonna blur my life.
I was trying to get the sound and everything to work all good.
Yeah, this how we gonna start the night off. So happy New Year's, Belinda. We were just saying it was last year when we did the
Mhm.
last one, and now it's
I know.
I know. It's been a bit busy couple weeks so far, but Happy New
Yeah.
Year's to everybody as well.
all right. Miss
Yeah.
Anna
Same
says
to
she is
you.
in Orlando, and her career is education. Miss Anna, how's the weather in Orlando right now? Is it freezing like everywhere? I doubt it, but wishful thinking.
If
Yeah,
y'all
it's
ain't,
cold.
if
I
y'all
got
ain't
my
in
warm
Chicago or
blanket
New
on.
York, I don't want to hear it.
Yes, because whew, New York,
It's
OMG. I'm cold. I got a warm blanket on.
okay. All
She like,
right. Okay.
she like, I got a warm blanket on.
I'm not mad at her. I'm not mad at her, okay?
Mm.
I'm cold. I'm chilly right now, but I guarantee you this sweater gonna be off in 5 minutes. I'm gonna have a night sweat. It ain't even
All right,
5 minutes.
April is in California, but we know it's not cold over there. Faith and wellness. And then we got Mr. Winston on, who is in New Orleans and is in production and manufacturing.
Okay,
Nice.
nice.
Welcome, Miss Gia.
Yeah.
Wait, my volume off.
Yeah, that's
No,
my
we can hear
baby.
you loud and
Oh,
clear.
okay. I thought it was off. Hey, y'all.
Hey girl.
Hey.
Hello.
That's my bestie.
My best friend. That's my best
Monday
friend.
evening. Okay.
Anna logged on too, Maya.
I know. Miss Anna with her warm blanket on.
Welcome for everybody that's joined in. Welcome, Diamond. Let's see who else I saw log in. Miss Zithia Owens. I don't want to say that wrong. Please charge it to my head and not my heart. Welcome everybody that is joined. Do me a favor. One, drop your location and your current career role or path in the chat. And then once you've done that, I'm going to put the screen up. I want you to do me a favor and go subscribe to the Nurses Magazine. Follow the Nurses Magazine on all platforms, and then follow me and my crew. And we'll introduce ourselves and get started in roughly about 3 minutes. We'll give everybody else time to log on. So go ahead and drop that info in the chat and then go find us on Instagram and follow the group.
Mhm.
Medical wig specialist. Nice.
Oh no, I just saw that. Oh,
Yeah.
medical wig specialist.
Wow.
That's mean.
Mm-hmm.
So, Miss Gia, I'm gonna be a little bit nosy. Do you cater to adults, kids, or both?
Even men.
Okay.
All
Mhm.
right. All right. Diamond is in Alabama, and I'm currently a patient access rep. And it's in school to be an LPN and future CRNA. And I'll put my stamp on it. Thanks for
Nice.
joining,
Yes,
Diamond.
yes,
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 thanks.
yes.
Welcome, welcome.
Blessings.
Let's make them.
Miss Jill, are you on Instagram? Because we might need to make sure that we have your connect.
Yeah, I put it in there. Let me see.
Okay.
I have a bunch. I'm gonna just put them.
Just drop a few of them in the. Just drop a
Yeah,
few
I'll
of them in
just
the
Woo,
drop
chat.
the main.
woo.
Yeah, I'll just drop
Don't
the
let her miss
main.
one. I'm your DIY.
Just other information for those of you that have joined, just FYI, this is being recorded, and it is also being streamed live as well. So right now, if you went to YouTube, we are on YouTube and stream live, as well as Facebook and Instagram as well. We up and live and active, and this is being recorded. Okay, got it.
Thank you.
Top hair prosthetic. All right.
Mm-hmm.
Oh, she missed
Right. It
some.
is.
That is not it.
Listen, mind your business. That's how we doing for the tonight.
Yeah, I'm gonna get into that, but nah, that ain't
Does
it.
one link to the other to the other? Is that kind
I'm
of how
looking
they go?
like I'm looking at the screen like, oh, she must still be typing.
No.
All right, ladies, we'll give it 2 more minutes and then we'll go ahead and get started. I want to respect everybody's time that did log on. I want us to be able to, ask questions, all of those things, and get off at a respectable time. I'll give it 2 more minutes and then we'll get started. All right, everybody, it is
Mhm.
7:11, so we're gonna get started. First thing I need everybody for me to do is
Mhm.
take a second and send your link to at least three people. So three random people have to be in healthcare. If they are in today's world, today's society, and dealing with all the things, there is definitely something in this conversation for them. So
Mhm.
take your link, send it to at least three people, so that they can join in. Any three people that you think would benefit from the conversation, that you know may be going through some things that they're not quite saying, send them the link and tell them to join in. We'll be here, and so whenever they're able to log on, um, we're all here and waiting. So just send it out to three people. I'm gonna give you about 30 seconds to do that, and we'll go ahead and kick it off. Anybody else having trouble hearing me? Belinda says she can't hear me. Can y'all hear me?
Yes, you're good. You're clear on my end.
Same, clear on my end.
You should have sent this link out to three people. So we're gonna go ahead and kick it off. When they join in, they join in. First and foremost, we're here to talk about burnout. We did a podcast on this at the beginning of, well, the end of last year. Still can't believe it's already 2026. So if you missed it, go to the Nurses Magazine on YouTube. It is there. You can catch up on the first one.
Mhm.
Um, this one we originally had planned. Our focus was on burnout part two, but we were leaning more towards what happened when people don't get treated and more towards suicide awareness and suicide prevention. But as y'all know, we've had a lot happen in the country in a short span of
Mhm.
time. Lives have been lost. It's been heavy for everybody. So we shifting our focus for this one to um, what happens when loss happens, and we just got to keep moving. And so pretty much that's where the entire country is right now. So I
Right.
want us to just take about 30 seconds and have a moment of silence for Alex, who is no longer with us, as well as all the other individuals that have been affected by ICE and all the things that are going on, because it's not an easy time for anybody. All of those that's get ready to be shipped off for military reasons. So I just want to take a moment of silence and say a prayer and some words for them and their. All right.
Mhm.
Well, let's go ahead, get this party roll. So, burnout, the silent struggle, part two. And so, what we're going to do for the next 45, 50 minutes while we're together, I'm going to do some welcome introductions. And we're going to do some content reflection questions for those of you that have just joined. Few things. One, this is being recorded. Two, is live on multiple platforms right now. The way this works is you all have to be engaging. We're going to ask questions. We're here to answer any questions, but we really
Mhm.
want to hear from you all. We do this every day. We live it, we work it, breathe it. And so we want y'all's perspective. And this is a safe space. So I just want to say that this is a safe space. We do full transparency here.
Mhm.
So what we talk about here, um, it is not something that you have to worry about repercussions or any of those things. We want you all to engage as much as possible. So we will do that. Then we'll spend some time, each of us, on a panel, me and my other three counterparts, which I will introduce shortly. We'll share some stories from our perspective, what we see day to day in our roles. And we'll, of course, have an open forum. We'll give y'all some key takeaways and some wellness tips to take away, and then do closing remarks. So that's what it'll look like. At any given time, if you need clarity on anything, raise your hand or mute yourself, whatever that looks like.
Mhm.
We want you to participate as much as possible. Is everybody okay with that? Is everybody okay with that? Give me a thumbs up in the chat, clap hands, a smiley face, something so that I know everybody's cool and okay with that. Right. All right. My favorite part is getting to introduce the amazing ladies that I do this with. My favorite part. So first and foremost, we have Miss Belinda King, a dedicated family nurse practitioner, entrepreneur, mental health advocate committed to
Mhm.
transforming wellness and expanding access to compassionate, evidence-based care. She is the owner of an outpatient mental health clinic in Columbia, South Carolina, where she provides integrative, patient-centered support for individuals navigating emotional and psychological changes. She also leads a nationwide wellness clinic specializing in medically assisted weight loss solutions designed to help clients achieve sustainable whole person health. In addition to her clinical leadership, she serves as a young associate clinical instructor and preceptor, shaping the next generation of healthcare providers through mentorship, academic excellence, and real world clinical training. Passion for continuous learning is reflected in her commitment to advance her own education. Somewhere in all of that, she also finds time to be a doctoral student at Aspen University, where she focuses on enhancing healthcare delivery, leadership, and
Mhm.
innovative wellness strategies. With a career grounded in compassion, integrity, and empowerment, Belinda integrates her advanced clinical expertise with her entrepreneurial vision to elevate mental health, expand equitable access to wellness, and inspire leaders across the healthcare continuum. Everybody light up the chat, throw some emoji signs, give me some thumbs up for Miss Belinda.
Woo-hoo-hoo.
And thank you so much for joining us this evening.
All right, next up. I know y'all see her all over social media, right? Because she has like 9,000 pages, working out, she's drinking coffee, drinking green stuff that I still ain't figured out what it is. But this is Miss Tamika Robertson, better known as Maya Fox on social media. She is a distinguished board certified family nurse practitioner with advanced expertise in cardiology and family practice. Born and raised in Chicago, she embodies resilience, compassion, and excellence in nursing. Her commitment to patient-centered care, advocacy, and emotional well-being has earned her recognition as Nurse of Excellence and induction into the National Honor Society. Tamika is not only a skilled clinician, but also a powerful voice for nurses everywhere. Her passion for addressing burnout, improving workplace culture, and uplifting the nursing profession makes her an invaluable contributor to today's conversation. She brings both lived experience and a deep understanding of the precious nursing space. And she is dedicated to creating spaces where nurses can heal, be heard, and truly thrive. Beyond her clinical role, she is a proud mom, a wife, an entrepreneur, brand new opening of her Glow Wave Hydration and Wellness business, and she still finds time to be a DMP student at Chamberlain University. She also enjoys traveling, mentoring the next generation of healthcare professionals, and using social media to educate, inspire, and advocate for wellness and professional growth. Y'all give it up for Miss Maya Fox.
Maya Fox.
Hey,
Woo-hoo-hoo.
y'all. Hey.
All right, next up, we have Miss Natalie Lee Ann Smith, actor and content creator. Still ain't the whole singing and acting thing and nursing, but she makes it work and she's great at it. Ms. Natalie is a registered nurse with more than a decade of experience in some of healthcare's most challenging specialties, including endocrinology, pulmonology, and neurology. She's known for her compassion, sharp clinical expertise, and unwavering commitment to patient-centered care. Natalie has built a reputation as a trusted and impactful clinician. But Natalie's talents extend far beyond the bedside. She is also a dynamic, creative with a passion for the arts and storytelling. She has performed at the McDonald's Gospel Fest and appeared in 3 seasons of the acclaimed medical drama New Era, bringing authenticity to her own spirited portrayal of a nurse and blending her clinical reality with the entertainment world. Natalie has now expanded her influence through her YouTube channel, Nat for Bella, where she shares lifestyle content, travel adventures, and honest reflections on her journey in healthcare. Her mission is to inspire others at the intersection of wellness, creativity, and purpose, proving that you can honor your calling while embracing every facet of who you are. Y'all give it up, Miss Natalie Leanne Smith.
Welcome, guys. Thanks for being here tonight.
And then y'all have me. All right. I am Chantrice Winston, a purpose-driven healthcare consultant and educator with over 2 decades of transformative leadership experience. I'm a nurse by training and a builder by heart. I'm devoted to my career to empower people, strengthen systems, and create workspaces where leaders and teams can genuinely thrive. From the bedside to the bedroom, and now founder of my own company, I embody my core belief that thriving isn't optional, it's intentional. My leadership is rooted in compassion, emotional intelligence, and a gift for turning struggle into strategy and purpose. I've led clinical education departments, program development, organizational strategy, and leadership coaching across the nation's largest health system. Known for cultivating psychological safe environments, I help individuals lead with clarity, authenticity, and confidence. Beyond my professional accomplishments, I am a mom, I am a wife, and a woman of faith, healing and growing intentionally. My personal journal, from trauma to peace, survival to purpose, fuels my mission to help others break cycles, rediscover themselves, and step boldly into who they were called to be. Are y'all ready? Let's get it. All right.
Let's
So I
get it,
told
get it.
y'all were gonna have to be interactive. And so here goes our interaction starting now. So get your thumbs ready, get your fingers ready, because in the chat, I need you to answer for me when life keeps moving, what usually gets pushed to the side? So when things are going crazy and it's all haywire, what are those things in your life that get pushed to the side? What are those things that get pushed by the wayside? Light up the chat. Let's see what we got. My wellness and peace, absolutely. Self-care. I think self-care is a big one for all of us. Our self-care completely goes by the wayside.
Mhm.
What else we got? I'm a mom and a fiance first. Definitely understand that. I think all the ladies, most of the ladies on there, we've been there where it's everything but you, and out of nature. And I think it's something my husband and I were talking about this earlier. I think it's something else with being in healthcare and a nurse. By design, you want to fix everything and you want to make everything okay. And we often take the back seat. What else we got? So we've got self-care, we got wellness and peace. Uh, what else we got? Somebody else give me something to check. Rest. Yeah, I don't think any of us sleep. Family. Yeah, family definitely sometimes take the hit. All right. So with that being said, my next question for you is, where do you feel the most pressure to hold it together? Is it your personal life? Is it home? Is it a combination of both? Or where do you feel the most pressure? Where do you feel the most tug from day to day? Oh, Belinda say both. Anna say both. Natalie's kind of combination. So everybody's both. And all of us saying both, we know that that's a problem, right?
Mhm.
There's a big problem because there should be a hierarchy of what matters in your life. But we've
Mhm.
gotten so accustomed to trying to do everything from everybody else till there is no hierarchy. We're running on fumes and autopilot, and at the end of the day, we
Right.
burned out, we're tired, we're exhausted, and that cup is empty. So that's the problem. And we're gonna work together and we're gonna talk together and figure out some strategies. How do we move past? All right, my next question. What expectations make it harder for you to slow down? For me, I know just being transparent, it is fear of failure. Okay, Belinda got financial. That
Yes.
probably is at the top of the list for a lot. You
Mhm.
need the money and you don't want to fail. You don't want to feel like you put all your work and your effort into something and then you're not successful. So I definitely think I feel the finances. All right. My next question, last question for the
That's
group.
great.
What would it feel like to give yourself permission to move at your own pace, even if it was just for a brief moment? Totally agree, Diamond. Holly is 23 and I'm still in that mind frame. Wanting them to, hey, wanting your kids to have it out. And mine are grown. And it's something about your baby girl. Just, I don't know. Yes, slowing down means uncomfortable. Slowing down means uncomfortable. Alignment, relief. So we're going to talk about these things. We're going to talk about what this look like, and we're going to take some time, and we're going to hear from the experts. We're going to hear from the individuals on my panel because I want to see how they are seeing things. So we have how y'all seeing things. We have how you all are feeling, how things are affecting. So now we're going to take a couple of minutes, and we're going to hear from the experts because I want to know what they're saying. So we're going to first start with Miss Belinda, is our FNP in mental health. And so, Ms. Belinda, tell me, what are you seeing, or tell us, what are you seeing with your patients? Has there been increase, or the signs and symptoms getting worse, or people coming to get help sooner or later? So, what are things looking like in that mental health?
Um, from a mental health standpoint, an increase in anxiety, obviously, depression, and increase in somatic symptoms meaning physical symptoms that can't be explained by any physical breakdown. So typically people with headaches and stomach ache and that have been ruled out by medicine, and it's just psychological in nature, induced by stress.
Mhm.
So that is what I'm saying. A lot of people need an FMLA. A lot of people need in short-term disability to take a mental health break from, work and stress and pressure as it relates to that. A lot of people can't afford to take that time off. And so I'm having to see a lot of dosage increase in some of the medicines that we use for anxiety and depression. People that refuse medicine in the beginning now coming back and saying, yeah, maybe I do need some help. So I'm seeing a lot of it. And a lot of it now, not even just in middle age people, but even in younger generations, like that are not understanding how to utilize coping skills. Maybe don't even understand what coping skills are. So I'm seeing 15-year-old, 13-year-old, 8-year-olds that don't understand or can't even articulate what anxiety is. And so it comes out behaviorally and showing up in school and acting out and things like that. So it's typically, you deal with it from people that have high stress jobs, but now it's just anybody. And it's
And
unfortunate.
being full transparency, and those of you on the call, y'all welcome to chime in, and that's what this is about, talking. I think a lot of it is because let's look at your average 8, 9, 13-year old. Most of them are being raised by us, and we didn't stop. We didn't take a break. Everybody that chimed in and said things are literally saying, "I didn't stop. I didn't take a break." I don't feel like I can take a break, and our kids have grown up being a hustle in us, and so it
Mhm.
does affect them differently. We didn't stop. We didn't go get the meds. We didn't go get the help, and so for most of it, we don't know how to notice the signs and help them relate, full transparency, because I didn't understand, and I didn't stop, and I didn't know. It literally took for me crashing and burning, having to, as Belinda just said, go on FMLA and take time and literally
Mhm.
hit rock bottom to realize that these are things that I've been dealing with for a long time that have been masked at other things. And then out of that, my child is now going through some of the same things and now on
Mhm.
meds and having to see a doctor. So for full transparency, we've raised, and so it's very hard when you don't even know how to explain what you're feeling or what you're going through,
Mhm.
or the generations before us. You're not allowed to break down. You're not allowed to have those things. You don't need to take meds, and so you live that way until you don't have a choice, and it just ends up filtering down. So that was going to be my question. Are you seeing more about adolescents, our, those teenagers that are coming in with some of the same issues?
Yeah, and I also want to be clear that typically when we do see children in that age that are dealing with stress and anxiety, seeing what's going on, seeing the impact that ICE is having on a lot of families, that's disrupting the homes, and maybe their counterparts aren't showing up to school because maybe their family unit was disrupted by ICE. It's really bad. It's really bad. It's sad. And sometimes I don't necessarily always have the right words to say or the answer. And I feel a sense of hopelessness as well when trying to treat and the effects of what's going on around us too. So it's and that contributes to burnout for me because what do you do? What do you say? How do you help?
And that's like our whole thing with, when laws has no pause, because even though there's the laws there and things are still happening, we still have to pick up and keep on.
Mhm.
These kids still have to pick up and keep going. Mamas and daddies have to pick up and keep going. Businesses have to keep going. So there is no pause. There is no time
Mhm.
to heal and regroup. And so it does end up coming out in other ways. And here's an acting up. Families are in, uproar. You come home, you tense, you're aggravated. Relationships are feeling the strain because there's a lot of what ifs. And we know if you turn the news on, that definitely doesn't help your anxiety level at all. Just to see what's the story for the day and what has happened today. Anything else you
Yeah.
want to add, Belinda? Any questions
No.
for Belinda, for anybody that has kids, anybody that's dealing with some of the somatic signs and symptoms? You had the headache, had the stomach aches, and you've been to the doctor and nothing else panned out. So is there anybody that has any questions for Belinda? This is the place and the time to ask, and she is very transparent and will give you very real answers.
I just want people to know that signs of stress and signs of burnout not only is not necessarily all mental. It does lead to physical issues
Mhm.
such as hypertension, and difficulty controlling blood sugar as it relates to stress. Inflammation can look like high blood glucose levels. Inflammation can look like pain that you just don't know where it's coming from. It can look like reflux because you got that increased gastric acid from stress. So those signs and symptoms as well. So not always just mental, but it can,
Physical too.
show up physical as well.
Mhm.
So be
Yeah.
mindful of those things too.
And so Diamond put in the chat. Honestly, I've had all of that lately. Aside from stomach aches, I've been a little dizzy and I can feel it in my chest. I can't really explain what it feels like. It's like butterflies in the chest. What would you say to her? Linda?
And foremost, psychiatry is always last on the totem pole. So those sorts of symptoms should not be ignored. Always have them rule out and certainly address with a primary care provider. If it gets to the point where it's worsening, obviously show up to your emergency departments to rule out any physical involvement. We want to make sure that we're ruling out anything that might be emergent. We don't want to always just jump to maybe I'm just stressed. And so certainly if you're having those symptoms, they are warranted symptoms that you really should take a look at and have your primary care doctor kind of do some further testing and those sorts of things to make sure that there's no other
Mhm.
underlying issues first. Once all of
Yeah.
that is all said and done and you get the green light in those areas, and the next thing they're gonna do, oh, go to psychiatry. Then yeah, certainly show up at my door and then let's talk about what options are available. If medicine is an option, or maybe you might can benefit from some therapy or a combination of both. So for certainly, if you're having those things, let's make sure that there's no underlying medical issues first, That is the priority, making sure that you're safe in those areas. And then after that, then certainly, talk to somebody about maybe seeing somebody for psychiatric, treatment and counseling therapy. And then again, obviously psych meds to help. Again, I always impress upon people, medicine only does about 40% of the work. The rest of the 60% of the way is our
Good.
responsibility. And medicine is not curative, it's supportive.
That's right.
Miss Anna said, she's on the other end of the spectrum. She says definitely showing up in my belly. And auntie premenopause is having a part. So what about our 40, 50-year-olds that are going through premenopause? How is stress affecting that as well?
Yeah, for sure. I mean, certainly menopause has a lot to do with how we have stress tolerance. If you have some stubborn weight, more than likely it could be as a result of increased cortisol. So it's a number of things where stress can show up. Menopause is a hormonal, and hormonal changes that we endure. So certainly those sorts of things need to be addressed with OBGYN, but outside of that, the psychiatric portion of menopause that could, some of those things can be alleviated maybe with some hormone balances. But in the same token, it's like they kind of go hand in hand. So once those things are certainly addressed and they still persist, and certainly look into maybe doing something, I always encourage eating right. I always encourage exercise as well,
Exercise.
especially for my menopausal women. Certainly that can kind of help slow that if the effects of menopause down and make it tolerable. But in the same tokens too, medicine from a psychiatric standpoint can support some of those symptoms as well as you're going through that change.
Last thing,
Mhm.
Belinda,
Mhm.
we are fortunate enough, we have some gentlemen on with us. So in our gentlemen, what would be some things that you would give them, some advice that you would give them? Um, just some of those somatic things to look for, because anxiety, depression, all looks different from us, male or female, age bracket. So for our guys, what would be some things that you would, some suggestions would have for them?
That therapy and counseling and psychiatry is real. And it is certainly worth you addressing that as well. Physical health and mental health are equally important. And as for men, obviously we hear that, men are taught to kind of hold things inside, and that mental health or having depression or anxiety is a component of weakness. And it is not. It's actually the opposite. Being able to talk about, what you're feeling, being able to confront what you're feeling is a sign of strength. So when I talk to my men about that, I let them know for sure that, first of all, I tell them now I appreciate them coming forth and actually saying, hey, I might need some help in this area, because that's a hard thing to do for men. So I, certainly commend them for even taking a step to come forward and encourage that they do that. Because sometimes even just talking about it and getting that weight off their shoulders is sometimes really all that is needed. But as far as psychiatric standpoint, as far as men, men, the first thing they worry about when they talk about psych meds is the sexual component of it. And yes, it is a real thing, but there are things that we can do to alleviate that as well, to if that should arise. So don't automatically get that in your head, because there's options out there that, would not interfere in that area. And a good provider is going to look at you holistically and, talk to you and give you recommendations where that is concerned. But the first thing is first is being able to say, okay, maybe I do need some help in this area, and then coming forward and actually going out and reaching to get that help. And we're here, we're here. We're human first before we're anything, right? And so with that being said, nobody is immune to depression. Nobody is immune to mental health. Nobody is immune to burnout. If that's the case, we wouldn't see a lot of these celebrities that got all of the money in the world, taking their lives and things like that. So it's not about money, it's not about status, it's about being human first. So
One of our gentlemen has asked, what do I do if the psych therapist I've gone to doesn't help? I had two separate therapists and didn't get help at all.
I'm sorry, say that again, Chantrice.
So it says, what do I do if psych therapy that I've gone to isn't help? I've seen two different therapists that didn't help at all.
Well, you have the choice to, first of all, find somebody who aligns with what it is you're looking for and goals. I mean, it's nothing worse than sitting on somebody's couch or going to a therapy and you're basically not addressing anything. You're just there, vomiting your life and you're not reaching any goals. And then, first of all, be clear with yourself about what you're looking for and, describe that when you're going to them. Tell them what your goal is for treatment. Because if not, they'll just keep sitting there taking your money, having you sit on the couch, and you're not getting anywhere. You can talk to a friend over the phone and vomit up what's going on, but you want to be able to reach, like, where do you see this going? Where do you see yourself? Where do you want for yourself out of all of this, out of therapy? Where do you want to change things at? And make that very clear. And after 1 or 2 sessions, if you don't see that, and then certainly take the opportunity to, cease the sessions and pivot. I mean, listen, you get a pair of shoes, they don't fit, what you gonna do? Keep wearing the shoes and, getting corns and blisters and it ain't going nowhere. No, you're gonna take them off and get you a new pair. So like I said, you have the option to go anywhere. But do your due diligence when you're looking for a therapist or a provider and see if their bio and what their training is, see if it aligns with what you are looking for and what goals you have for yourself.
And I would also suggest being honest with the therapist. I know when I started therapy, the first day of my very first therapist, she was my daughter's age, and she asked me like what signs I was having anxiety, and I said tachycardia, and she was like, "What is that?" It's like, okay, this is not gonna work because if I have to sit here and explain those kind of things, this is not going to work. And she understood, and she helped me navigate me to an individual that was better for what I needed and that could get me the help and assistance that I needed, and it's worked fine. So that's another thing that I would say, Gerald, if that therapist isn't working, let them know what's not working, and maybe they can guide you in the direction of somebody else in their office that will give you what you need. What I will say is don't stop trying until you find your match. And as Tamika said, that person is out there.
And I appreciate you for saying that too, Chantrice, because, a lot of times people come to providers and counselors and therapists and, they sit down and they withhold information. The difference of the here is that we're psychiatrists or psychotherapists. We're not psychics. So we don't, if you don't tell us, we don't know. You're only going to get as good as what you give. So if you're withholding information, you're not forthcoming, there's not a whole bunch that person has to be able to work off of. And that comes that you're pretty vulnerable, and that's a hard place to be in. But unfortunately, that's the place you have to be in order to, get the help that you need. And, sometimes people aren't ready to explore that, and it takes a level of readiness where that is concerned. So yeah, I thank you for saying that, because you do have to be open.
Miss April, I see your hand up, so we'll come to you, and then we're going to go to Miss Maya Fox. So Miss April.
Yes, can you hear me?
Yes, ma'am.
Okay. Being a nurse at the bedside and being on the other side of the stethoscope, and I'll speak to recent. When you are a patient and also being a nurse and you advocate for your patients, as a patient, a lot of times when you ask questions about your health, when you do try to advocate for your health, you're seen as argumentative, not wanting to be compliant, and difficult. A lot of times, medical providers and staff can be intimidating and not very nurturing. So that's one thing that people have to be aware of as well. So it's hard to speak up for yourself, especially when you are feeling vulnerable. It's hard to put yourself open and out there when you don't feel that sense of compassion or even understanding from people that you seek medical care and help from. So that's something that a lot of people just really don't understand. I've seen it, I've witnessed it, and even speaking up on a patient's behalf as their nurse, a lot of times, you do catch a lot of flack. And then once the statement is made, it's a defense mechanism that's put out on you. Again, you're hard to work with, or you are, difficult or argumentative. So, and that doesn't give you the sense of wanting to reach out or anything. But for me, I don't care. And the reason why I say that is because I experienced it just recently. And because I asked questions that I didn't agree with, because if your care isn't aligned to help you improve
Mm-hmm.
or even addresses the issues that you have, it's my right to question. It's
Right.
my right to ask for other things.
It
I'm
is.
not on WebMD. I'm not
Mhm.
trying to be the doctor, but I'm asking questions from a viewpoint of how it affects me. And if you feel that's not a lane or something that is affecting the issue, then that's when the explanation comes in. That's when you educate. But a lot of times it doesn't happen that way. People get real defensive and then they want to have that authoritative air over you. And again,
Tamika,
that can
I'm
be
gonna let you address
And
that.
yes.
okay.
So
Sorry.
honestly, I think it's when providers are like that, I think they're uncomfortable because they really can't help. And that's their defense mechanism. Like you said, they hold their titles over you and things like that. I think they're just as afraid because they don't want to say the wrong thing either. So they kind of blow it off and not making an excuse for them by any means. Because I actually had to approach a colleague about a patient that I was seeing for years. And this lady ended up unhappy because she was with the new provider. And I asked her why. I really wanted to get to the bottom of it because I was hearing it so much.
Mhm.
But this provider told me, she said, I just get uncomfortable when they ask me questions that kind of hit close to home. So a lot of times providers really don't know what the patient is going through to be able to explain, and vice versa. The patient don't know what the provider is going through to be able to explain. So I think it's more of a defense mechanism, which doesn't make it right. But you as the patient, you should always make sure that, hey, I want to ask this question. I need an answer. And if you're not being delivered the right information, then you have to move on. And it sucks because it's hard to find providers in healthcare that you're comfortable with, that you want to stick with. You don't want to keep switching providers. But we do have some people out there that was not properly trained to
Mhm.
deal with a lot of stuff that come through the door.
Right.
For me, psych, it was not, it was at the bottom of the barrel for me. I didn't want to do psych. I didn't want to do psych for several reasons. But because in my community, there's a lack of psychiatrists and psychologists, so I was forced to be that for my patients. And after COVID, it wasn't 20% psych, 80% family practice. It was 70% psych, and that's a large percentage for something that I wasn't trained to do. So I had to learn my patience. I had to be prepared for uncomfortable situations, uncomfortable conversations about depression, anxiety. And honestly, until I had my own panic attack, you can't tell me I didn't have, I really didn't understand it from their perspective. When I had that one moment in my life, I completely took that and I understood these patients so much more. So it's almost like if you don't experience it, you don't understand it fully. But that doesn't make you incompetent to deal with it as a provider
Mhm.
because it comes with the career regardless. Like you cannot escape it at all. So just to answer your question, so basically that person was probably more uncomfortable and needed a defense mechanism, and that's just how they deal with
Yes.
things.
That's the other thing that I would say that from, doing this for over 20 years, typically providers that are defensive like that, one, like Tamika said, they have no idea, they don't know the answer to the question, and their title won't let them be humble enough to say, that's one.
Mm.
And two, still having to realize that they're human too. And we don't know what they went through, what happened to them that day, and they just may be at the point that they triggered. It's not right. But the same way we want people to understand our burnout and what we're going through, we have to give that same grace to somebody else because you never
Hmm.
know what they're going
Mhm.
through.
Exactly.
Um,
Exactly.
so that's what I would say. Diamond, I see your comment, and I can speak to this a little bit, and I also let Belinda said, She said she think a part of being afraid of saying the wrong thing, knowing that we have to report certain things. I've been told that's why some of the men I'm around don't go to therapy. So what I can say from that standpoint, because I was that patient when I first started going to therapy, I told certain things, but not everything, because I was afraid if I said everything that was in my head, I was going to end up with a jacket in a room to make me hug myself. Until my therapist had to tell me that's not how that works. We're going to talk about it. We're going to give you some coping mechanisms, some coping skills, but I can't help you if you're not willing to be honest. But if you tell me certain things, it's not like I'm going to call two 7 feet guys in here to put you in a jacket and, lock you in a room. That's TV. That's not really how that works. But if you don't know, you don't ask. Belinda, you want to
Exactly.
speak to that a little bit more?
Yeah, so there are laws in psychiatry that we do have to abide by as far as telling. Um, there are things, so the responsibility of the provider, I'm trying to find my thing here. The responsibility of the provider is to make you aware of what is reportable and what is not. So essentially, what is reportable is, instances of child abuse or instances of something called a tariff law. Like if you plan to murder your boss, I have a duty to warn. Oh, okay, so I'm just going to be honest. But in the same token, it is my responsibility to create an environment that you feel comfortable having open discussions with me and letting you know. So if you tell me that you feel like you want to hurt yourself, I'm not getting ready to, I'm not, the SWAT team is not going to come down and haul you off to the hospital. I have people that have chronic suicidality. Nothing you can do is going to change that. However, if you have a plan, if you started to work things out, I have a duty to keep you safe. And so, yes, if I feel like you're going to be a danger to yourself or others, I have a
You have
duty
to
to warn.
report that.
I
Yeah.
have to, I'm a mandated reporter.
Reporter, yeah.
So I'm just being, and certainly I make my clients aware of what is reportable and what is, client patient confidentiality, much of which is client patient confidentiality. But if you plan on leaving my office and going to kill your ex-wife and all those things, yes, I have a duty to warn.
To report
But
that.
if if you're feeling down and you feel like wanting to hurt yourself, first I have to assess. Do you feel safe going back home? Do you feel safe right now? Do you feel like you want to carry this out? What is preventing you from carrying that? So there's things that we can do. We can create a safety plan with each other. I can connect you to people that can keep you safe over the next couple of days. Or if you don't feel safe, you can voluntarily admit yourself to the hospital until you feel safe or get stabilized if you don't want to go back home or if you are fearful that you may carry some things out. So there's a lot of things that are reportable. And then a lot of things that, again, if you're just feeling down and you're having a bad day, no, I'm not calling 911. I can't speak to all providers. Everybody practices medicine differently. Okay. It is necessary to create environments to where as though your clients feel comfortable being vulnerable in that space and saying, hey, this is a bad day for me. I'm not doing well. I don't think I can make it the rest of the day. Then we need to have that conversation. And my job is to keep you safe. And if keeping you safe says, hey, okay, listen, let's talk about next steps. Does this look like in hospital admission for you? Do you need to take respite? Do you need some time in the hospital or somewhere where you can just rest without thinking about bills, without thinking about life? And you can do that on a voluntary basis. Okay. It's not something that I'm going to, put you in the hospital and then take your rights away for 72 hours. No, that can happen. It has happened. But in the same token, those are things that are reportable. If you're a danger to yourself or others, if you have a substance abuse problem where you're going to hurt yourself, if you're gravely disabled, if you plan on, have homicidal ideations, those sorts of things are reportable. I have to intervene. Hope that answers your question.
Tamika, from your standpoint, because I know you are still like actively in the hospital seeing patients and all of those things. So for you, what are you seeing in your patient population? I know cardiology is like your special. Are you seeing an increase in your patients with hypertension, with coming in with chest pain, as having all of
Absolutely.
those?
Absolutely. And just to rebut on what Belinda and Diamond mentioned. So what I'm seeing is hospital readmissions. I'm talking you discharge, you back 3 to 4 days after. Why? Because some of those symptoms that Diamond and Anna mentioned, they're complaining of that. And as being in cardiology, you have to work them up. That heart comes first. If
Mhm.
they're saying I'm having chest pain, depending on how they describe it, because I dig deep because I know the difference in a cardiac type of chest pain based on a complaint. But at the end of the day, no matter how deep I dig, you have to say it's real. They can have all of this test at the hospital that's negative. Then you can say, but what's happening is with healthcare is that we're forced to do all of these cardiac tests because people are coming in. They're more
The
depressed and anxious
symptom.
than anything, but they're complaining of chest pain. It'd be
Mhm.
just our luck if we disregard the patient despite, labs and stuff being normal. And then they're
Something
back 2 days
happened.
and they didn't had a heart
Mhm.
attack.
Yeah.
So yeah, there's an increase in hospital readmissions, there's an increase in cardiac testing, stress tests, CT coronaries, things like that, because people are so depressed and anxious. And the reason being is because two factors that I've noticed where the community that I work in, they have to be put on these medications because their heart muscle is so weak. They have to put on these medications that they can't afford. But this is the
Oh.
only medication that's going to help you. Or they have to leave
Mhm.
the hospital with a life vest and the insurance don't want to cover.
Right.
That's the other big ordeal with the insurance. And they'll listen to the education, do what needs to be done, but they're back in 2 days. Why? They took that life vest off. They don't want to have it
Not
on. They didn't
compliant.
pick up their medication from the pharmacy because
Non-compliant.
no one called them, just
Mhm.
non-compliant. And just
Non-compliance.
it's just the financial portion of it is heavy for them. And they tell me because I asked, I'm
Mhm.
like, I really need to know how you got back here, and I have to take my white coat off a lot because it's very intimidating. But I take
Mhm.
my white coat off, I pull a chair up, and it's hard for me because my time management is very poor in the hospital because I've been in an outpatient setting. I know what it takes to lower the readmissions. No, it's not my job alone, but I know what
But
I
you
can
still
do
do it. Yeah.
for some of these
Mhm.
patients. And,
Mhm.
and that way my time management is poor, but that's okay. I think about that later. So I have to pull a chair up and say, hey, tell me what the real problem is, because
Mhm.
people, they feel like no one's listening. No matter what I say, I'll say this just to get them out of my face. But when you actually sit there and figure out what's going on, you really find the right answer and you can help
Mhm.
it.
Yeah.
You get a social worker involved. There's so many different resources
Case
for these patients
management
at the
and stuff.
hospital. Yes.
Yeah.
But these
So
patients,
let me say this about, and I think we do it as healthcare professionals. We like to use the word non-compliant.
Mhm.
But if I'm having to decide between meds that's $1,200 a month and a roof over my head, probably going to choose
Pick
the
the
roof over
roof,
my
right?
head.
Yeah.
Doesn't make me non-compliant. I have to make, as they say, a pimp decision. Like I got to figure out what's most essential. And, it's not just me that I'm providing a roof for. I'm providing a roof for me and my kids and, other individuals as well. So I think as healthcare professionals, we have to be sensitive to that and really
Mhm.
decide what's non-compliant versus my lifestyle doesn't afford these medications or my insurance isn't covering for this. Because I don't think anybody wakes up intentionally every day and just like, I'm not going to do right. You know
exactly.
those patients,
Yeah.
though. You know the ones that's going to do it. That's
Yeah.
eat everything, drink everything, miss dialysis, and they coming back. That's your true non-compliant patient. But for our patients that are
It's
um,
really struggling, right?
literally
And
struggling, we got
yeah.
to come up with
Yeah.
another word for them other than
But
Mhm.
non-compliant
I
because
was gonna say
that's not
that.
Now
I was
realistic.
gonna
they're
say that.
not
It sucks
consistent.
because
They're
in a
inconsistent.
hospital setting, I know
Mhm.
I can change it a little bit in the outpatient, but in a hospital setting, the word non-compliant is really the appropriate medical term. But what I've done in my HPI and my notes, I'll say,
Mhm.
this patient is pleasantly non-compliant.
Mm.
And, I make sure I say they cannot afford it. I say in my
Supposed to
notes
specify.
what this
Yeah.
truth is because
Yeah.
I had a patient come to me like, yeah, I read my notes. They keep saying I'm non-compliant and I can't fucking afford it. And they cursing you out. And I'm like, I
Mm.
had to explain to a couple of patients what non-compliant mean. It doesn't mean you purposely did this. It means there were so many different barriers to you
As
doing
to
what you
why
need to do
you
for your
can't. Well,
health. That's
mhm.
the word we have to use, unfortunately, because it is a true medical term. And
Mhm.
it sucks because they get that impression that they think I don't care. So guess what? I don't. So I have to I have to go to these patients all the time.
And
It's exhausting. And
explain.
that's when the
Yeah.
burnout come in because you're trying to protect yourself, protect your organization, protect
Hmm.
everything that you're there for because you want this person to go home knowing like someone really care for you. Like I'm an advocate for you.
Right.
You know, and when you had these conversations, some of them people that was coming in the door, I was seeing them once a week in the hospital. It's like, what are you doing here? What are you doing?
And I
But you
think
sit
for
down and you
us,
give them
at
money.
one point, we didn't have all the notes. They didn't see the notes in their hand, you know. So what we wrote in the chart, they didn't have access to that. Whereas now,
It's
they
all
can go see
digital
that,
and they
and
could
that's the
see
first
it.
thing they see.
Yeah.
They say
Listen, they
that was
pulling those
It's
notes
magical.
up.
digital.
They are pulling those notes up at
It's,
their
yeah.
admission. They be like,
Yeah.
yesterday. I'm like, girl, I wasn't even here. What are you talking about?
But we were taught what, we were in psychiatry, and I don't know if it's the same on the medicines from a medicine standpoint. And
Mhm.
I'm just to speak to that term, we were encouraged to use the term non-adherent because it is less judgmental. And we are having patients that have access to their charts. And they're seeing that. And a lot of times they do feel like they are being judged, and that, like you mentioned, that they have to choose between their light bill and this medicine. It's not that I don't want to, it's just that I just can't. And so
Yeah.
this takes precedence. So it doesn't mean that I'm doing this on purpose or I don't want to. It just means that I'm not able to, and I have to prioritize my care or prioritize things differently. So we were encouraged to use the term non-adherent for that reason. And I don't know, just like
Well,
we
it's a
can't use the
Covers us
word,
CPT
it
code. It's
covers
a
legally.
CPT
It's
code for
just like we
non-compliance,
can't
and it's
use
non-compliance.
we can't use the word cow anymore. Remember, we used to work for
Oh,
the computer
yeah,
on
on
wheels.
Yeah,
We
you
wheels.
can't
can't
use
Yeah.
say
that
that because people
anymore.
see cow and you think you calling them a
Can't
cow.
use it. We got
oh
to use
Lord.
workstation on wheels
But you
because
know
someone.
what? That's a problem too because patients and clients, because we describe them in different ways,
Mhm.
they've become so sensitive. I've noticed that since COVID too, and I think that has increased the depression part of their health as well. They're so
It has.
sensitive and they're removing these words and this different terminology because they say it affects the patients, but it's like that's the problem. We're becoming so weak as a country. Like everything bothers us. Using a
Yeah.
certain word, all it is, it aids in depression as well. Because
Yeah, it does.
if we as a society let people think that this word is intimidating, things like that, everyone gonna take it and run, and then it becomes a problem. And it's so basic in everything else that's going on. You like, what the heck,
Yeah,
So.
your words, they say your tongue is powerful. Words, I mean, depending on and it's a lot of times it's not even what you say, it's the way you say it.
And how you
Um,
say it,
and
how
I
it's
know that
delivered.
I'm a
Yeah.
big
Yeah.
one on that. Okay, so Natalie, we're gonna flip the switch to you because you're
Hmm.
still out here in the trenches. So
In the
what are you
trenches.
seeing? Because you got it both worlds. You got like the patients, family, family members, your co-workers, like
Yeah. So for me, I see more like the somatic symptoms on my coworkers, to be honest, though. I
Oh.
see it more on my coworkers. So going back to how we respond to stress and how we cope and how it can show physically, right, in ourselves. I had a coworker who was constantly getting headaches, high blood pressure. She went out on FMLA. She came back last week. The first day she came back to the job, her pressure was like 180 over 100. So it just goes to show like it's definitely our environment that affects us physically.
Mm-hmm.
And we have to find better ways, like Belinda was saying, to cope. It's how we cope that can affect us overall, right? So it's a matter of finding ways to cope with our stressors and ways to, decrease symptoms that we feel. Um,
I think
mm,
overall we
yeah.
all it doesn't matter what profession you're in right now, we all kind of go to work with a lot of the unknowns. Like we
Mm-hmm.
know the state of our country right now. We know how layoffs are going. We know ICE is walking into buildings, people are having to keep ID and things on them and all of those things. And so we're dealing with all of those
All
stressors.
of
You're dealing
that.
with stuff
Yeah.
at home. And then you have your patients, you have your families. Going back to what Tamika was saying, they have Google now and they have their phones. And so as soon as you
Mm-hmm.
say something, they Googling it. Or everybody now is also in some aspect, which is why there's so much protecting and being careful of what you say, because everything
Mm-hmm.
is a lawsuit now.
Oh yeah,
Everything
definitely.
is a suable offense, and
Mm-hmm.
you're cutting a check, and so everybody is dealing with their own stressors. And I think for us, when we go into a work environment, and I don't care what that environment is, people that old saying leave work at home at work is not reality. Like we are that same person, and sometimes it's hard to cut that off. But in our world, in our profession, like you say, you see it on your coworkers. And so
Mm-hmm.
if I already came to work with a headache, I'm already aggravated. And so
Mm-hmm.
then this patient doesn't want to take this meds or
Then that's
can't get the
adding to
doctor to
it.
call me
Exactly.
back, or
Yeah.
the family is bothering me for a cup of ice. And now I'm written up because my attitude is ugly when I'm already in here with the somatic
What?
symptoms and I'm already
Mm-hmm.
depressed and nobody's seeing that and that's going by the wayside. So it's literally your career and life is one, and it's kind of hard right now to
To
separate
separate the
that.
two,
Yeah,
yeah,
and
it
separate
is.
that to separate the two. Let's see. Diamond, I believe the idea that this is what we signed up for, so we should be able to take it is playing a part in the burnout, because just because this is my career doesn't mean it needs to be uncomfortable. So
Mm-hmm.
when we
It
open
doesn't.
up about being stressed or anxious, it's shrugged off because we signed up for that, quote unquote, which leads to loneliness.
Mm-hmm.
Oh, right. Agreed. And if society looks at us, and I don't care what job you are, you can work at McDonald's. And
Mm-hmm.
if we guilty of it, you go to McDonald's and the person behind the counter got a nasty attitude, the first thing you're gonna say is, don't get mad at me because you work at McDonald's. So it doesn't matter what
It
industry you're
doesn't.
That
in.
is so
Mm-hmm.
true.
That's how people
That's
look
true.
at it.
Yeah.
I didn't tell you to come to this job. You
Right.
decided to come to this job. You signed up for this and you filled out the application. But what, and Diamond, speaking to what you said, you can't pour from it if like the somatic symptoms. I'm gonna tell you, I had them. Oh, I had the tachycardia in
Me
meetings. My
too. The
heart rate
headaches for
160,
me.
170. The headache,
Mm-hmm.
not
Mm-hmm.
being able to sleep, being angry with everybody. I had every last one of them, which is why I woke up one day and said, I can't do this anymore. I am literally killing myself from the inside out. And you have to get to that point, and it's unfortunate that I had to be made to stop, because before that, I didn't understand how to stop. I didn't understand the concept of I can't do it all, or I didn't. Um, what do you recommend for functioning depression? Therapy and med. I am transparent. I see a therapist. Now I'm at the point where I see my therapist every 4 weeks. I see a psychiatrist every 8 weeks, and I take my meds every day
Mm-hmm.
because I need them. And I had to get to the point where I accepted them. And I had to get to the point that this makes me feel normal. This makes me be able to operate. This helps me to be a wife and to be a mom and to be active and do all the things I'm able to do to own a business. If I had tried to do any of that, if I had tried to do this before getting meds and having somebody to talk to, I wouldn't have been able to do it, because I walked around literally every day angry and upset. And it was because I was depressed. That's how my dealt with my depression and my anxiety. I was just angry with everybody. I was that nurse that literally, when I was still at the bedside, people didn't want to give me report. It was like, can you just write it out for her? Because I was just angry. And I didn't
Mm-hmm.
understand why I was so angry.
Mm-hmm.
Um, so that's my recommendation wholeheartedly. To function, you have to be okay with accepting you need somebody to talk to, and you may need
Mm-hmm.
medication, and it doesn't make you crazy. It makes you strong, and it makes you able to function in the world and do what you need to do and be productive. That's my 2 cents on.
Yeah, and also acknowledging your feelings, right? Instead of suppressing it. Remember, your feelings are valid and you should talk to somebody, like Santrice was saying, a therapist. They work. They work. They work.
Melinda said it in the beginning,
Hmm.
medicine only does a part of it. Medicine
Right,
helps control your hormones and get you chemically balanced, but you still have to do the work. You
right.
have to find a root cause of what that problem is. You have to be okay with speaking and saying, this is what I'm feeling, this is what I'm going on. And as you're saying, you feel okay for the most part, and then you break down. that means something triggered you to break
Mm-hmm.
down. You didn't just break down. Your trigger happened, and that took you
That
down.
led to
That's what
that. Yeah.
got.
Mm-hmm.
And so you may need to have therapy to help for somebody to help you identify what that trigger is and how do I cope with it. These are my coping skills. But until you acknowledge it, it's very hard. Um, but at least you are acknowledging the emotion. Like I'm crying, I'm getting it out. But I'm a strong believer in talking to somebody. Everybody doesn't need medication. Sometimes
Yeah.
it's just talking, but you got to start somewhere. You got to be able to have an outlet to get it all out.
I usually say this too, like if repeated exposure to it, the trigger, is going to keep that depression stagnant. It's going to be retarded. It's not going to improve. And so typically, I say to people, like, Chantrice mentioned, what is the trigger? Get to the root cause and then figure out ways that you could, change that situation. So if your job is the one that is causing it, and we all don't have the luxury to go from job to job, but if the job is a significant trigger and you realize this and you've identified it, then you might need to start thinking of a strategy on which ways that you could either improve where you are or change the situation.
Right.
I always tell people to remember this, especially if it's something that they keep re-exposing themselves to. Nothing changes if nothing changes.
That's right.
Simple as that. So if it's, your old man ain't nothing and he ain't been nothing for years and
Then you
y'all
got to
still
change
putting up
that.
with it,
Yeah.
then
Yeah.
is it really him or is it you
Or
at this point? So you have to
right.
look at that. That's a behavioral way of looking at it, cognitive behavioral way of changing your circumstances, along with what Chantrice mentioned, maybe because depression is not just an emotional thing, it's a chemical imbalance. So let's just be clear. And
Mhm.
then so it's antidepressants are a form of a way of, balancing that chemical imbalance while you behaviorally make the change as well. So they kind of go hand in hand. So, kind of remember that, what is the trigger? What am I doing? What can I do differently to change my situation that keeps putting me here? And then again, sometimes too, that maybe as we get older, our brain doesn't function as well as it did. We're not as resilient as we were when we were younger. And so we do need help in some areas. Maybe we do need it, vitamin D, as so those sorts of things. So just, kind of keep that in mind too. And I agree, a good cry ain't never hurt nobody.
Never hurt nobody. Color. That's a good one. Get you an adult coloring book in color. I found that work. Journaling. But you have to find an outlet. You have to find what that looks like. So we have roughly about 15 minutes left. I'm going to open up open forum. Um, you all that are on that have joined, questions, concerns. As you saw, we are transparent. We're going to answer your questions to the best of our ability. And if one doesn't know, the other one may know the answer, but that's what we're here for. So if there's anybody that wants to unmute, type it in the chat, whatever that looks like for you. If you're uncomfortable with unmuting, you can do that or put it in the chat. If there's specific questions that you have for any of us.
Are medical professionals advocating more at the job site to you have this information, you know what it can do to your employees? How do they initiate these type of programming or care at jobs to help alleviate some of this stuff that's happening? Because if you're working in a profession that has the background knowledge to know what stress can cause and depression, are we advocating in that aspect?
Well, I do know a lot of companies and organizations, not just hospitals and medical, they are, a lot of people don't know this, but if you have insurance with your company, a lot of times they have psychiatric help. But you know what? It's sad because they don't push it a lot. I didn't even know we had it for our company. You can actually be connected with a therapist through your organization. So that's something people should start looking at because it's there for you. And to remember, HIPAA laws is still they can't talk to other employees about this information. So if you look into it, believe it or not, that may be there may be help within your company when
most
it comes to
companies,
therapy.
part of your
Yeah.
benefits, you have
Yeah.
EAP, Employee Assistance
Mm,
Program, and it usually gets you, depending on your insurance, it usually gets you 6 to 8 free visits before they
mhm,
start charging. So that's one avenue. From
Hmm.
a organization and a system standpoint, it starts at the head. Your leaders build your culture and what that looks like. And so, a part of my business is which I work really hard is to get leaders and system leaders to understand. They set the culture and they set the tone, and they have to make mental health. They have to make it important. Like you have to do checkup. You have to be personable with your staff. When you see somebody that's off, ask them what's going on, what's happening. Like
Hmm.
you have to be intentional with those things. And
mhm.
when you get up to a certain point, organizations, when you're in the boardroom, it's about the bottom dollar and it's about the outcomes. And my goal is to get them to understand that without your people, there is no outcomes and there is no productivity. And your productivity is in the toilet because your people are burned out
You're
and they are
dependent
they
on the
cut.
people. Mhm,
And so you have to go back to people. And so, the advice that I would give is start small, start on your unit, start with your team, doing check-ins. Like it was a thing for my team. We text each other every morning, what your battery level on today. If your battery level is less than 60%, okay, what can we do as a team to get you to the other 40%? But it's small things like that that make a difference. But you have start somewhere. You're absolutely right. We can't keep talking about it and not putting boots to the ground and putting action to it. So if you know that's an issue in your organization, start that. In my previous organization, they started a wellness committee, and they met um, every day of the week, Monday through Friday, and then they did 2 hours. There were some days that it was a therapy session. There were some days that they did potting. There were some days that they did yoga, but it was offered at work. It was offered through the job, and it gave people just time to just walk away. Also, all of our units were required to create Zen rooms. So just a room that had nothing to do with work, that they can go in, grab a cup of coffee, some tea, sit in a recliner, but that have that ability. So you got to start somewhere. Somebody in your organization has to advocate for wellness. It has to start. We just got to stop talking about it and put boots to the ground. And if all else fails, go to my website, send me an email, and I'll come in and get everybody right. What else we got?
I see
Diamond
Diamond.
says,
Oh,
any advice for new grads? Go ahead, Tamika, what you got for that?
listen, I have to say this. Don't be afraid that you don't know everything. Okay? Utilize your resources. Learn your system, but don't be afraid to ask because
yeah,
I work with a lot of new grads that make decisions because they're afraid. They're afraid to say they don't know. Make sure you ask and then be culturally competent. Understand that everyone walking in the door is not going to abide by the same culture. It's going to be something different that you may not understand, but also ask the patient. If you don't know, they actually love it when you question their culture. That means you care, you want to learn more about them, you want to be an advocate for them. So don't be afraid that you don't know. Use your resources and just make sure you're confident. Go in with confidence, build your confidence. It takes a while in nursing. Nursing is not easy. It takes a while in any field when you're learning in any career. When you're new, there's a lot to learn, but you won't learn it all in the same time frame. So just give yourself
What I
grace.
would also add to that is, and I tell all new
mm,
grads, get a
mhm,
mentor. Find somebody, and it don't matter what profession you're in, whether you're an engineer, whatever it is that you want to do, you want to be a truck driver, cut hair, find a mentor. Find
Hmm.
somebody that is in that career that you look up to, that you can model yourself to. And I offered in one of my programs as well. And I tell them, get that mentor, get that person that you can mirror yourself to. Um, Reach if it's something, if it's a content creator, Google,
yeah,
chat GPT, the top 5 content creators, and
mhm,
whatever it is that you want to do, reach out to them on social media. Most of them will respond to you, and you just need a mentor, but get you a mentor. anything
Mhm.
that you're going
Mhm.
into, because that
Mhm.
helps. You're gonna need somebody to, and it has to be somebody that's in that field of career, because there are gonna be things that you need to talk about that only that person is gonna be able to understand and relate. What I will also say, and I tell new grads, is if there is an internship that's offered at an organization near you, if you're not
Go for it.
already in the hospital, but if there's an internship, take part of that. It helps you learn a system. It helps you interview them and them interview you. So get a mentor, work in a system, and figure out your niche. There is
Yeah.
9,000 things that you can do in nursing. Everybody is not going to go to ICU. Everybody's
Or
not going to
med
do emergency
surge.
room
Yeah.
or med
Mhm.
surge.
Yeah.
Everybody don't do mamas and babies. I know that's off limits. I don't do mamas and babies under no circumstances. But
Mhm.
find your niche. It may be a school nurse. It
Mhm.
may be corporate nursing. Like with nursing, there are so many
There's so
things
many
to do,
avenues, right? So
so
many
many,
avenues.
so
Yeah.
many avenues. So get a mentor and find your niche is what the advice that I would give.
And
Mhm.
I would say to be open to feedback. I mean, like, you won't know everything, but be open to feedback and opportunities to grow. And another thing I would say is to leave work at work, right? And avoid burnout that way.
Absolutely.
Yeah. Leave
Leave
work
it at
at
work.
Great
work.
When you
one.
clock out, leave it.
That's there. Leave it there.
All right.
And
Any other questions?
prioritizing self-care. That's a big one. Even for new grads, old, all of us.
Mhm.
Yeah, don't be like us. Don't be like this. You know what, y'all? My daddy about to make me cry. Thank you, Daddy. I love you too.
Mhm.
I love you too. Um, any other questions, concerns, anything else that anybody wants to say from my panel, my team, anything else that you all want to say, want to add to it? Natalie, Maya, Belinda, y'all good?
Yeah, I mean, at the end of the day, I think we have to accept that things are life, the world around us is changing.
Mhm.
When we have to kind of adapt to those changes, be it good, bad, or indifferent. We're seeing a lot of things that are happening around us that will indirectly or directly affect us in one way or another. And so steal away and just stay grounded and connected and whatever that means to you, so that way you don't lose yourself with all the
Yeah,
changes that is happening around us, because it's easy to do.
right.
Certainly, if you feel like you are being, you're drowning, certainly reach up, because there's always somebody there to kind of pull you the rest of the way. So,
Mhm.
Mhm.
Natalie, Ethan. All right, y'all. So first and foremost, thank y'all so much for joining us, for hanging out with us. Stay tuned. We'll be back again. If you haven't already, for those of you that logged on late, please go and subscribe to the Nurse Magazine, and then go to Instagram and follow all of us. Follow the Nurse Magazine. This is my Instagram handle. This is Tamika's. This is Natalie's, and this is Belinda's. So go follow us on social media. What we would also like for you all to do is on your platforms, you can make a simple post. It was great. It could be negative. You want to do that too. We'll take it
Right.
all right now.
Yeah. Mhm.
But go and make a post, tag the Nurses Magazine podcast, so that we can get the revenues to continue to do this, and we can continue to get the support. I am also going to, in the chat, I am dropping a link. And I'm also going to put the QR code on the screen for those of you that are not on your phone. Please take a few minutes and do the survey. It's only about 10 questions. Most of them is like agree or disagree, but do the survey for us. It gives us the opportunity to improve. And I'm also going to, one of the questions is your email. And it's not to identify who said what, it's more that we can keep in touch with you. We can send you out information as we're developing and doing things in our businesses. Also, as the magazine is growing, we want to be able to keep in touch with you and let you all know when the next podcast.
And
So
we
with that
appreciate it.
being said, I will say I appreciate y'all. Thank y'all
Yes.
so much. I will let my team say their good nights and their goodbyes. And then y'all, once y'all got the
Thank you,
information for the
ladies.
Thank
survey,
you.
Thank you,
good to go.
everyone.
Right, y'all. I'll hang out here
Thank
for a few
you.
minutes. You're
Thanks a lot.
welcome. Righty.
Good
Bye.
night.
Thank you,
Bye.
team.